Longevity Lab session is with Dr. Sahil Sanghavi, who's an orthopedic surgeon, and we'll talk more about Sahil in the coming slides. What I wanted to quickly do was make a couple of requests. Uh, Please stay on mute so that so the audio is everyone can hear clearly. And as and when you have questions, please type them away into the chat window so that at the end, I'll make sure to ask as many of them as we can fit in. There have already been a number of questions that have been sent in advance of the meeting by members of the community. So we already have those. But as you come up with questions, please do type them away. All right. All right. So I'll just quickly provide some background on the Longevity Lab, what we do. So we um, have sessions like this one. So these are expert weekly sessions where we talk to an expert like Sahil, and they come across various domains, but the focus is really on uh, insights around health span and longevity. The second thing we do over here is we run these custom programs on specific issues. They are 2 week, 4 week type of programs. We are running one right now. The third one is the members of the community all provide insight to each other. They share their learnings and so on. The fourth thing, we have tools that we have built for our own health that we have now for everybody else to get access to. I'm just going to put whoever's on not on mute. I'm just going to put them on mute. Okay. And then the fifth thing that we do is if there are specific longevity, wellness, health span type of products, we validate them and then we offer them to our members. We do not take a cut of any of this. The community itself is free. We don't take cuts of any of these products because our objective is that people find that living healthy can be inexpensive, can be simple, and can actually be fun. So that's what this community is all about. And so if you're not a member, all you need to do is take a scan of the QR code and you'll get onto the WhatsApp group. And every Thursday at this time, we have sessions like the one we're going to have now. For those who want to watch snippets, you can watch them on our YouTube channel, or if you want to read my blog post where I write about all of this, you can go to my Substack blog post. If you're part of the community, every session like the one we're having right now, a recording is sent the next day. All right, so that's it. Let's move to Sahil. First of all, I want to welcome Sahil, and I'm not going to read through all of this. It's there on the screen for everyone to read. It's an abridged version of Sahil's background. It's, when I sent out the message about Sahil, I had a lot more to say. And Sahil, being Sahil, very, very understated, modest, he said, Nikhil, it makes it sound a little too boastful. I said, you don't have to boast. You are not that type of person, but I get to boast on your behalf. And so I think suffice to say that Sahil is a very accomplished. Even though he's young, he's done a lot. And I think if you read through that, it's pretty clear that it's no surprise that he's accomplished what he's accomplished. And so today we get to pick Sahil's brain on things that will help each of us live healthier, and not just us. Many of us have, older parents, uncles, aunts, grandparents, and very many of them are dealing with orthopedic issues, hip pain, knee surgeries, and even what are some of the things that can help them will be discussed on today's call. So without further ado, Sahil, welcome to the community meet.
Thank you. Thank you so much, Nikhil, for having me here.
So Sahil, why don't we jump right into it? Maybe we can start off with just a couple of minutes of, your background. While the details of your biography are here, just more like you're a Pune boy, right? You grew up in Pune and you went around the world to do your various education. But Just talk a little bit. I know, for example, you're a Loyalite.
Correct. So, I was born and brought up in Pune. I was in Loyola High School. That's where I did my schooling. My medical school and post graduation were all in Pune. And after that, after I completed my residency or my specialization in orthopedics, I decided to specialize in hip and knee replacements. So those are the surgeries that I now specialize in, and I exclusively do only hip and knee replacements. And before I started my practice, I was away. I took a sabbatical for a couple of years and traveled to a few hospitals in the US, France, and Germany to get more experience and learn the latest techniques around the world that are being done in hip and knee replacement. And now I'm practicing in Pune at Sancheti Hospital, which is where I specialize in hip and knee replacement surgery.
Perfect. That's amazing. And I remember, Sahil, maybe was it about 3, 4, 5 years back, you and I once had a chat about genetics, right?
Yes.
So you've definitely had a lot of very wide interests. It's not just, I mean, while you specialize now in this, you have sort of exposed yourself to a lot of different aspects. And I think that makes you who you are.
Thank
Right?
you.
So let's get to the first question. We talk on this in this community meet every week about metabolism and how it plays a role. It's sort of like the base for a lot of different issues that eventually appear in our lives, whether it's heart disease, diabetes, cancer. But from what I understand, and this is something you can definitely help clarify for us, is does metabolism also play a role in bone health and joint health as we age?
Yeah. So, Nikhil, metabolism, essentially, what do you mean by the word metabolism? So, just to simplify it, it essentially means that the food you consume is converted into energy in the body to repair a lot of tissues and maintain the various organs and tissues in the body at an optimal functioning level. So, metabolism is essentially the engine that's driving your body. Now, broadly, you have two types of metabolism. That's anabolism and catabolism. Anabolism means the body is essentially building something, whereas catabolism essentially means destruction, or your body is destroying something. So it's important to understand that bones are not really a rigid structure in your body, but it's a dynamic structure. So what do I mean by the word dynamic? Is that bones are constantly undergoing a phenomenon called as remodeling. So remodeling essentially means that at every point in time in your body is essentially building new bone, and at the same time, it's destroying some bone. So while it's building new blocks of bone, it's also absorbing or resorbing bone and making it slightly weaker. So if your metabolism is suboptimal, then you can have two problems. One is there will be an increase in the rate at which your body is absorbing or resorbing bone, or there will be another problem where your body is essentially slowing down the process of forming new bone. So metabolism is not just dependent on your calcium, your D3, it's also dependent on other nutrients like phosphorus, your protein intake, and also it's dependent on many hormones, which is why you often find people with diabetes and thyroid, fatty liver, insulin resistance, or kidney issues. They often have a higher risk of osteoporosis and arthritis. So which is why as we age, what happens is our metabolism is slowing down. And as metabolism slows down, your body is not able to absorb all these nutrients in the optimal way. And along with that, the biggest detrimental factor as we age that affects our metabolism leads to something called as sarcopenia, which is essentially loss of your muscle mass in the body. So what happens is when you start losing muscle mass in your body, it actually places a higher stress on the bones and joints of the body, because your muscles and bones are both working hand in hand. It's like imagine you're driving a car and the pressure in one of the tires is low. What's that going to do is essentially place more load and more stress on the other three tires. So that's how metabolism and muscle loss affects bone health.
Yeah. I mean, there's a lot of very, very key points in what you just said, Sahil. I mean, one is metabolism is not just about, hey, I don't want to get diabetes, so I should look after my lifestyle. right?
Correct.
Lifestyle impacts metabolism, and metabolism impacts even bone health. One interesting statistic that has been around for a while is that as we get older, obviously the chances of a fall, that where you break your hip, goes up. And the statistic that I read is once you're above 60, if you have a hip, if you have a fall and you break your hip, there's a 20 to 30% chance you die within a year.
Correct.
Now, that's not because of the hip fall break itself. It is because of everything else that comes with it, right? And so, the importance of muscle mass, the importance of ensuring your bones are strong, they're both critical, not just because you want to avoid surgery, but because you want to remain strong and increase your longevity. And so, people don't appreciate the value or the importance of bone health and metabolism in bone health, until much later in life. But the reality is those steps have to be taken now.
That's right.
Right? And so, given that, what are some biomarkers, some tests that one should do to help to sort of know whether you are on the right track, whether your bone health is good, your muscle health is good, and so on?
Yeah, Nikhil. So most often people think that bone health is only to do with calcium. That's true that 99% of the calcium in your body is essentially stored in bones. But it's important to understand firstly that calcium in the blood. So if you do a blood test and your calcium level is fine, you're often wondering why your doctor has prescribed certain calcium or vitamin D supplements to you. So firstly, it's important to understand that calcium in the blood is not the same as calcium in the bones. Now, calcium in the blood is extremely important for the body to function because it looks after important functions like the beating of your heart or conduction of your nerves. So that is why your body is always working overtime to maintain calcium in a very tight, normal range in the blood. Now, if what happens is if the calcium in your body or your blood starts going down, the body is going to actually remove calcium from the bones and put it into the blood. So that's why at any given time when you test the calcium really in your blood samples, it's almost always going to be normal. But that is not a true reflection of the actual calcium that's there in your bones. For example, it's like money in the wallet versus money in the bank. Both are different. So the real gold standard for testing bone health is what we call as a DEXA scan. That's a dual energy X-ray absorptiometry scan. That's the medical full form for it. But what the DEXA scan really is, it's a non-invasive test which involves a slightly low amount of radiation, and it throws up something called as a T-score. So what this T-score is, essentially, it compares your bone density level or the health of your bones to that of a young adult. Now this T-score ranges from positive and negative values. So if you have a T-score which is above -1, it essentially means your bone health is pretty normal. If it's in the range of -1 to -2.5, that means it's termed as osteopenia, which is early osteoporosis, or it's an early warning sign that your bone health is deteriorating. But if your T-score is less than -2.5, then that means you have osteoporosis. So what is osteoporosis? It's basically reduction in the density of your bones. So if you take a wall which is made up of, for example, which is made up of 100 red bricks, that's normal bone. Now from that wall, if you remove 50 bricks, you're only left with 50 remaining bricks. That is called as osteoporosis. So it's a quantitative problem in the structure of your bone. Now what's the problem with osteoporosis is that it's essentially a silent disease. Means there are no warning signs or no alarm bells that really start throwing off gradually. But the biggest or the first manifestation of osteoporosis is often a fracture when it's too late to really go back and reverse it. So the DEXA scan is really the gold standard for measuring your bone health. So who should do a DEXA scan? By and far, all women and men above the age of 65 to 70 respectively, as also more importantly, postmenopausal women who are above the age of 50 to 55, and men above 50 with certain risk factors like smoking, excessive use of steroids, excessive alcohol or tobacco consumption should also do a DEXA scan. So that is what the really DEXA scan tells you is about your bone health. It's the gold standard test to tell you or reflect about your bone health.
And Sahil, just to double click on that, is there any downside for a 40-year-old, right? For example, to do a DEXA scan? I mean, there is a little bit of radiation, but I'm assuming that's not
No, there's
excessive.
absolutely no downside to doing a DEXA scan if you're in your 40s, because the dose of radiation is really low. And you don't really need to keep doing a DEXA scan every month. You at the most repeat it once in a year or once in 2 years. So it's a very minimal dose of radiation that's actually being used in a DEXA scan.
Yeah. And from what I understand, I've done a DEXA scan once or twice, and it gives you more than just bone health, right? It also gives you some other pretty useful metrics. Anything you would say on those other metrics, Sahil, or would you just look at it for the bones health?
Correct. So one important thing that a lot of people, especially athletes, look into and why they use a DEXA scan is because it also tells you and accurately reflects your fat percentage. For example, if I weigh 70 kgs and I want to know how much of that is really made up of my bones and how much of that weight is actually being contributed by the fat in my body, that's also an important metric that the DEXA scan throws up. In addition, it can also tell you which part of your bones are becoming more weaker. Is it your spine that's more at risk? Is it your wrist joint or your hip joint? So there are a lot of different parameters that the DEXA scan throws up, and these are the two main ones.
Yeah. And I just want to add for everybody else on the call that you get these cheaper 2,000 rupee BCA scales on Amazon, and it will tell you your visceral fat, it will tell you your bone health. They're not very accurate, but they serve more as a trending thing, right? Is it going up? Is it going down? But the thing that's special about DEXA scan is that it gives you a 3D view of, like Sahil said, is it this part of your is your issue in the upper part of your body? Is it in your arms? Is it in your legs? So it can give you sort of a much better view. And so the way I personally do this is I have the cheaper scales at home that I can use on a daily basis. That's more to know whether it's moving up or down. I do a in-body scan, which I do probably once every 3 months, and I do a DEXA scan every couple of years. And so between these things, you can get a pretty good sense for how your body is evolving. And it also brings up an important point, and which is we always measure ourselves based on our weight. We judge ourselves on our weight. But there can be two people with the exact same weight, but with very different body compositions. One can have a lot of muscle, reasonable amount of fat, good bone health. Somebody else could have a lot of fat, not too much muscle, poor bone health. Both will have the same weight. And so that's something that I think, I'm sure, Sahil, you get asked this question a lot, right? Hey, what about my weight is too much? But it's about what's the composition of your weight, right?
Correct. And also dealing with weight, it's important whether is it central obesity or again peripheral obesity. We won't go into that, but that again is important, and that's also where the DEXA scan is kind of useful.
Yeah, perfectly. Ashok, can you just go on mute, please? Okay. All right, next question. You spoke about osteoporosis, Sahil. The other term we keep hearing is arthritis. Can you just talk about osteoporosis versus arthritis?
So arthritis, Nikhil, essentially is inflammation in the joints of your body. The word arthro means joints and itis means inflammation. So arthritis is essentially a broad umbrella term which tells you that there is inflammation in the joint. But there are again various types of arthritis. You can have osteoarthritis, rheumatoid arthritis, gouty arthritis, ankylosing spondylitis, psoriatic arthritis. So there are a lot of different types of arthritis, but let's touch upon the 2-3 main types of arthritis. So what is osteoarthritis? Osteoarthritis is essentially age-related wear and tear of the joints in your body, and this largely affects the larger joints of the body, such as the hips and the knees, and is often seen usually in patients who are above the age of 50 to 60. On the other hand, you have rheumatoid arthritis. So what is rheumatoid arthritis? It's an autoimmune disorder. What do we mean by autoimmune? Means the immune system in your body or your immunity is affected, which is why your body immune system believes that the joints of your body, whether it's your fingers, toes, shoulder, hip, that all these joints don't essentially belong to you, but they belong to someone else, or it's a foreign part in your body, and which is why your immune system starts attacking these joints. So that is what is called as rheumatoid arthritis, which is commonly seen in females in the age of 40 to 60. Similarly, another autoimmune issue is ankylosing spondylitis, where your body again progressively becomes stiffer in the neck and your spine. Another type of arthritis is called as what is associated with gout, which is called as gouty arthritis. In gout, what happens is there is increase in the amount of uric acid in your body. So gout was essentially called as the king's disease. Why king's disease? Because it was associated with your diet. If you have a diet which is essentially rich in red meat, wine, beer, processed and sugary foods, then this leads to gout because there is an increase in the amount of purine or associated protein that you're consuming. So it was often in olden days associated with those people who are quite wealthy or who are from the royal family because they would have this type of diet. And this is often seen when you get an acute pain in your great toe. So that is what is called as gout. Now, why is it important to differentiate these types of arthritis? Is because the treatment again is different. For example, it's not just about pain control or controlling the inflammation in the joint. Let's say you have a patient who has fever. You're not only going to give the patient some paracetamol to reduce the fever. It's important to know why the patient really has fever in the first place. Is it because of typhoid, malaria, chikungunya, or what's really causing the fever? Till you don't diagnose the cause, you're never going to make the patient better. So in the same way, it's important to differentiate between osteoarthritis and rheumatoid arthritis. In osteoarthritis, your pain essentially becomes worse with activity and it improves with rest. Whereas in rheumatoid arthritis, it's the opposite. So activity makes the pain better or reduces the pain, whereas rest essentially worsens the pain. So let's say you have two patients and one patient tells me that, doctor, I wake up in the morning, I'm feeling fresh, I go for my morning walk, but after 10 to 15 minutes, my knees start hurting a lot and then I just can't walk anymore. That's osteoarthritis. And on the other hand, if you have a patient that tells you, doctor, when I wake up in the morning, my body is stiff, my fingers and toes are quite stiff, I have quite a task in getting out of bed, but I push myself to go for a morning walk. The first 5-10 minutes are difficult, but once I walk for 10 minutes, I feel great, and then I can even walk up to an hour. That's rheumatoid arthritis. So that is why it's important to differentiate the type of arthritis, because for rheumatoid arthritis, you have to do some blood tests and start different categories of medications. Whereas for osteoarthritis, again, the treatment is quite different. So that's why it's important to understand what the various types of arthritis are, what each patient has, and then to tailor the treatment strategy accordingly.
That is amazing example you use, Sahil, because now it becomes a lot more real to differentiate between the two, because the way it showed up, one, it happened after the fact, the pain. One, you started with the pain and then it goes away. And that I had no idea of any of this. So thank you for sharing that beautiful example. From taking supplements, that you earlier said calcium is the one that gets all the attention, but very often it requires more than just calcium. What are the things that, and I'm assuming, of course, it's a very nuanced answer, but broad strokes, what are the supplements that one should even consider and based on what?
So the most important supplements are calcium and vitamin D. Why are these two important? Are because they essentially go hand in hand. A lot of times it's difficult to know how much calcium is there in your bones, like I mentioned, by just doing a blood calcium test, because your blood calcium is more or less going to be normal. But along with that, if your body has deficient in vitamin D, that is a red flag that you really need to start taking supplements. So why are calcium and vitamin D supplements taken together or hand in hand? is because for calcium to be absorbed by the body, you need vitamin D. If you don't have vitamin D and you're consuming a lot of calcium through tablets or through your diet, it's essentially just going to be eliminated out of your body and excreted without being absorbed. And that is the most important mistake a lot of patients take, is that they feel it's important only to take calcium and not vitamin D and not test any other parameters. So vitamin D, serum albumin, and phosphorus are usually other tests that we do in such patients. And at the same time, another important doubt that patients have is, when should I be taking these supplements? Should I take calcium separately, vitamin D separately? Should I be taking it early morning on an empty stomach, or at night, before food, after food? So the most important take-home message is that calcium and vitamin D supplements should be taken after your meal, not on an empty stomach or before your meal, because your calcium and vitamin D, for it to be optimally absorbed in the body, it requires the presence of acid in your stomach. So that's why if you take it with a meal, that acid actually helps the absorption of calcium and vitamin D. Another distinct point is that you have two types of vitamins. One can be water soluble, like B12 and vitamin C, but vitamin D, on the other hand, is actually a fat soluble vitamin. So that's why what I recommend to patients is that you should be taking vitamin D with the heaviest or your largest meal of the day. Why? Because the fat in the meal will actually help vitamin D to get absorbed in a larger dose or a larger amount as compared to that when you take it on an empty stomach. So that's why calcium, vitamin D, phosphorus usually go hand in hand.
Yeah, and I want to really reiterate the point you just made. For a long time I was taking vitamin D, but I was taking it on an empty stomach because all I was told was take vitamin D. This subtlety that you just described, right, that vitamin D is fat soluble, should be taken after a heavy meal, a fat heavy meal for sure. That was not said. And so I was taking it, I was thinking I was doing something good for my body, but it just went straight through. It didn't get
Correct.
absorbed by anything. And so, that's why they joke that nowadays the world's urine is amongst the most expensive, because we all take all these vitamins and all of that, and they go straight through and show up in our urine, but it doesn't actually get absorbed. And
Yeah,
the other point you made is, if you do a blood test, it'll show it's in your bloodstream. But that doesn't mean anything. Just because it's in your bloodstream doesn't mean it got absorbed. And
correct.
so I think for everyone on the call, if there's just one thing you can take away, and there's a lot of stuff you can take away, but the one thing if you take away is, especially when it comes to calcium and vitamin D, they go hand in hand. One helps with the absorption of the other, but both need to be taken on a full stomach. And the last comment I'll make on that is, almost 75 to probably 90% of Indians are vitamin D deficient. And
Yeah.
so, you can almost not go wrong. While I'm not a big fan of supplements in general, I think there are a few, and vitamin D is one of those that I think you'll not go wrong by taking it. Do your blood test, not just the standard vitamin D, the one that shows the absorption, but you can't go wrong with vitamin D, especially if you're South Asian, of South Asian origin.
So Nikhil, if I may just add to that, a lot of time patients think that they're never really deficient in vitamin D. And that's because you're taught in schools that sunlight is associated with vitamin D. But there's something which is called as a tropical or an Indian paradox, if I may say so. What this essentially means is that one would think, oh, in India, there's a lot of sunlight, we're outdoors, and we would actually be having an optimal amount of vitamin D in our body. But that's not true. And that is what is called as the tropical or Indian paradox. And that's because largely for vitamin D, you need about 60% of your body surface area to be exposed to sunlight. Now, in this heat, if you tell a patient that go and wait in the sun for half an hour just in your swimming trunk or something, it's obviously not possible. So at the same time, it's important to understand that even though we live in a country where there's a lot of sunlight, we are still paradoxically extremely deficient in vitamin D. And at the same time, we use sunscreen when we go out, or we're completely covered from head to toe. And we also have slightly darker skin compared to those in the West. That is why even absorption of vitamin D is actually hampered significantly. So that's why vitamin D is something which almost all of us are essentially deficient in.
Yeah. And you want the UV levels to be higher from a vitamin D absorption point of view, right? From a sunlight. But on the
Correct.
other hand, you don't want to be out in that type of UV. So
Yeah,
that's the other issue that you have to keep balancing. And so I think net, the takeaway is exactly what you said, Sahil, which is take it. You can't go wrong with
correct.
it. Right? Um, I know there are questions streaming in, so I want to get through our because there's so much to talk about, Sahil. So, uh, you know, people talk a lot about strength training, resistance exercises, and so on. Can you talk a little bit about the importance of that when one thinks about their bone and joint and muscle health?
Yeah. So, Nikhil, often when I see patients in the clinic and I ask them, do you exercise? They say, of course, I exercise every day. And when I ask them, what exercise do you really do? It's often a combination of a morning or an evening walk and some yoga. So that's the definition of exercise for most people. And while that is extremely good, no doubt about it, that's not really great or optimal for your bones and muscles. Because while these exercises are good for your endurance or your flexibility, they don't really do justice to your muscle mass and your bone density. And that's where the role of strength training or resistance training comes into play. So, when you talk about strength training, it's essentially lifting weights and improving your muscle mass. And resistance training is are exercises which involve your muscles working against some force, which can even be a resistance band, or it can even be your body force while doing some Pilates exercises. So that is resistance training. So, of course, strength training is a type of resistance training. And why this is important and why people might wonder is what's the real connection between muscle mass and bone density or bone health. So let's go back to anatomy of the human body. And where do muscles really lie in the human body? While they may be on the surface, they actually originate and get inserted. So the start point and end point of almost every muscle in your body is on the bones. So when you're exercising and doing these strength training or resistance training exercises to contract your muscles or build up your muscle strength, with every contraction of the muscle, what it does is the muscle essentially pulls on the bone. And this pull or the force that is exerted on the bone sends a signal to your body that your bones need to start becoming stronger to take that stress or to be able to take that pull of the muscle load. And that's what happens to when you're exercising and doing strength training or resistance training, is that your body is getting a signal to improve the density or the strength of your bones, and your bone density accordingly adapts. So that is the real relationship between muscle mass and bone density. And that's why strength training and resistance training are more important than endurance or flexibility training when it comes to bone health.
Yeah, and I think just like Indians are generally deficient in vitamin D, Indians generally do not engage in strength training.
Yeah,
Our definition, and I know I was in that boat for a long time, that exercise meant cardio,
correct.
right? But cardio has a role, like you said, to play, but strength training does too. And as we get older, that role becomes more and more critical. And so, again, another great takeaway message for everybody on the call is um, I know it can be intimidating if you've not never done it before in your life, but start small, get a trainer, and really start strength training because the impact on bone health, on metabolic health is just amazing. And so, definitely a must do on should be on everybody's list. Um, we touched upon this briefly, Sahil, earlier, but when it comes to diet, right? Uh, what are some things that you absolutely would recommend from a bone health perspective?
For diet, so Nikhil, diet really plays a much bigger role in joint health and bone health than most people actually realize.
Yeah.
What happens is if you have a poor diet, most Indians are essentially, you would think, are averagely built and are not overweight, but they would actually have a slightly bigger belly than most people, while their arms and legs are thin. So what a poor diet does is it increases your weight. What is the relationship between weight gain and bone health? It's quite simple, and you'll be surprised to know that for every kg or for 1 kilo of body weight that you put on, your hips and knees are actually subjected to 4 added kilos of pressure while they're walking. And
Wow.
now, if you've put on weight, your knees and hips are going to get loaded more. Then you start having knee pain and hip pain. What this does is it essentially puts you into a vicious cycle where your poor diet has led to weight gain has led to hip and knee pain. And now, because of these aches and pains, you don't want to be as active and exercise or go for a walk or hit the gym, which is why you start putting on even more weight. And that actually ends up worsening your hip and knee pain. So that's why this is a vicious cycle that most patients get caught into. And that's where the role of hydrotherapy comes in. So hydrotherapy is often what I prescribe for such patients because hydrotherapy means exercising in water. And what this does is it there is a concept of buoyancy. So when you're in water, the load of your body weight that's acting on your hips and knees actually starts reducing. So let's imagine you're in a pool of water which is up to your waist level. This will decrease the amount of force on your knees by almost 50%. Increase the level of this water up to your chest, and that reduces the pressure on your knees by almost 70%. And when you increase the water level up to your neck, it's actually reduced by 90%. So only 10 to 20% of that force is actually acting on your knees. And that's why even in our hospital, we have a underwater treadmill in our physiotherapy department. And a lot of these patients actually benefit tremendously with this hydrotherapy. At the same time, we often get them to consult a dietitian because, broadly speaking, you can classify foods as being pro-inflammatory and anti-inflammatory. Pro-inflammatory means they're increasing the inflammation in your body. And as we just spoke, arthritis is essentially inflammation in the joints of your body. So a lot of times, patients who have a diet which is rich in red meat, processed foods, sugars, or trans fats are actually more at risk of inflammation in the body. Opposed to which, you have certain foods which are like essentially fruits, vegetables, omega-3, nuts, olive oil, all of which are anti-inflammatory. So they reduce the inflammation in your body. So that's the essential role of diet, weight, and knee pain or arthritis.
No, that's brilliant. Last week the topic of on our call with the endocrinologist was about the again inflammatory foods, right? Anti and pro-inflammatory, and the role it plays across the board is pretty significant. And we had put out after the call a list of good, anti-inflammatory foods. And what we'll do is after today's call, we'll put that list out again for those who have joined since last time. It's a good list, and it's worthwhile ensuring we are all staying on top of eating the right foods. And along those lines, Sahil, what is the role? I know the role of protein when it comes to muscle building is clear. Is there a role of protein or any of the macronutrients when it comes to bone health?
Yeah, so of course, protein, like I mentioned, is extremely important because you don't want to be having sarcopenia, that's loss of muscle mass. I saw a couple of patients who got into these fat diets and went into extreme fasting measures and lost a lot of weight. But what it essentially did is it was only depleting their muscle mass because their protein intake had gone down considerably. And that placed them at a risk. Actually, two of those patients even had something called as a stress fracture. That means that your bones are supposed to be normal, but they start becoming so weak that even the normal stress of your body weight cannot be taken by the bones. So along with proteins, it's important to have vitamin C, magnesium, zinc, phosphorus. These are the essential nutrients or supplements you need to have, along with, of course, calcium and vitamin D that we spoke about.
Yeah. And Sahil, you brought up an important point. So on the call, I think we also have Salil. And one of the topics we always sort of discuss is the role of fasting. I mean, fasting has a lot of good stuff that comes with it, but when they're taken to much longer levels, right, 36, 48-hour fast, you are definitely moving into the territory of, not having enough protein. You're moving towards sarcopenia. And so fasting has to be done very carefully. Right? It's not something that, because people read something and then they go down this path. But there is so much subtlety, and I'm really glad you brought up this point, and I'm sure Salil will also resonate with this point that 24-hour, 36-hour fasts are okay, but you're already beginning to push it if you do it too often.
Yeah,
But the role of the nutrients you mentioned
correct.
is equally critical, not just the protein, but the rest of the nutrients as well. So maybe we'll do one last question and then we'll move to questions from the audience. I mean, maybe there are two questions I want to ask. One is, our parents are getting older. And
Hmm.
I know in my own dad's home in Pune, uh, because he's had enough number of falls, we have tried to put all these guardrails around the house so that he has something to hold on to when he's walking around. These are things that we never did earlier. But, we have to start thinking about it. I'm sure, given all the experience you've had with people having falls and this and that, what do you advise people as they get older? How to sort of safety proof their home?
Hmm. Yeah, so Nikhil, that's a very important point, and the reason this is becoming more and more important is if you look at India's population trend, it's actually increasing more in the age group which is geriatric or even above 60. And by 2050 or 2055, if I'm not mistaken, it's said that 20 to 25% of our country's population will actually be made up of individuals above the age of 60 to 65. Now, why this is startling or important from the point of fall prevention or mobility and balance is because these patients, or for example, they come into the casualty with a hip fracture. So every second call I probably get from the casualty is a classic story of a 70, 75-year-old patient who slipped in the bathroom, has had a fall, has fractured their hip, and now needs to undergo a surgery to fix their hip or replace their hips. So, why is this important and what can be done? Firstly, as we mentioned, muscle strengthening exercises are, of course, important. But in these patients, what is even more important is to introduce the concept of balance exercises, such as simple balance exercises like standing on one leg or walking on a straight line, touching your heel and toes alternatively on a straight line, and avoiding the mistake of polypharmacy. A lot of times now we are in the era of specialization. So you go to one doctor who gives you two medicines, you take your parents or your grandparents to another doctor who gives them four other medicines. And all these medicines are interacting with each other in ways that are not anticipated by each individual doctor. And that actually causes a lot of disturbances in the balance that the body has to play while walking. So what can you do to really prevent these falls is it's quite simple, because whenever we have patients who come into the casualty with a fall or in the emergency room with a fall, it's not that they've fallen on the road or in the mall or had an accident. It's 90% of the times it's that they've had a fall at home, and most often they've slipped and fallen in the bathroom.
Yeah.
Why is again this important to prevent these falls? Is because hip fractures, like you mentioned, are considered as the sentinel event or a terminal event in the lives of these patients. Because at 1 year from a hip fracture, the mortality rate is actually 20 to 30%. So 20 to 30% of geriatric patients who have a hip fracture can't really make it beyond 1 year from that point in time. Now, like I mentioned, the good news is that it's largely preventable. So we even have a fall prevention program in the hospital. And what we do in this program is essentially send a team to visit the patient's house where your parents or grandparents are staying. And they sort of analyze what modifications can be made. So simple modifications like the path from the patient's bed to the bathroom should be free of any rugs or mats or any cords, cables, wires that you may have. At the same time, in the bathroom, you can install some grab bars or handrails, which makes it easier for them to sit and stand from the toilet seat or when they're having a shower. Avoid having polished or slippery tiles in the bathroom. You can install those non-skid mats that you get, which will prevent these falls because there's often water on the floor. And again, you can keep a torch or some light near the bed of the patient, which they can use when they wake up in the middle of the night to go to the bathroom. At the same time, avoid having your parents and grandparents wear slippers because that often triggers a fall. So it's better if they wear closed footwear and even use some walking aids for patients who have Parkinson's and balance issues or those who've had a stroke in the past. For them, it's very important to use a walking stick or a walking frame, especially in the house when they're left unsupervised. And last but not the least, you should have their vision checked periodically every year or two to prevent these falls.
Wow, Sahil, this is such an amazing list. What we'll do is we'll take just this section that you said and put it as one of the short clips. Because if someone just wants to know what to do for their parents, this is a very comprehensive and practical list because you've lived through all of this yourself and seen all these things happen. So thanks for sharing that. Last question from me before we move on to audience questions. You're a surgeon and you're doing all these, I'm sure, more and more increasingly sophisticated surgeries. Can you talk a little bit about this rate of progress in this whole hip and knee replacements and all of that?
Yeah, so like I said, I specialize in hip and knee replacements. So if I were to ask you, Nikhil, that which operation do you think is the most successful from head to toe? And you'll be surprised to know it's actually a total hip replacement. So a total hip replacement has been called as the operation of the century because it's that successful and life-changing. So the surgeries that were being done 20, 25 years ago for hip and knee replacement are drastically different than what we do today. So nowadays we have implants which very closely mimic the natural joint, which is the natural hip and the natural knee joint. In addition, there are a lot of recent advances like robotics, augmented reality, which help us plan surgeries better and individualize it to every patient. Similarly, in the past, when I was a medical student and I would watch knee replacements or hip replacements, there would be a big cut that was made, which was almost 20, 30 centimeters. But now the concept has evolved to something called as MIS. That's minimally invasive surgery, where it's hardly a 10 to 15 centimeter cut at the most. We barely cut any muscles or tissues around the joints. And that's why this has helped us evolve to a concept of fast track surgery or daycare surgery. Now, what this means is that patients nowadays are coming into the hospital in the morning, and even by the evening or the next day itself, they're back in the comfort of their homes, having undergone a hip or a knee replacement. So this is a big new trend that has caught on, which is called as daycare surgery or outpatient surgery for hip and knee replacement. Like, I remember when I was a medical student and my grandmom underwent a knee replacement. She was in the hospital for almost 10 to 15 days. First 3-4 days, she was in tremendous pain. Then she was gradually able to walk properly after a week. But now, essentially, what was a 10 to 15 day stay for a surgery has now gone down to 10 to 15 hours in and out of the hospital. So that's how life-changing and easygoing hip and knee replacements have become today.
Yeah, that's fascinating. And the fact that the success rate is so high, and from what I understand, the person can go back to living a normal life, doing the treks that they wanted to do within what, weeks, months?
Yeah, within 2 to 3 weeks,
Yeah,
they're about almost as good as back to normal.
that is, yeah, I've never heard of that happening with many other surgeries. And I myself have gone through enough surgeries, neck, leg, everything. So I know how long that took. All right, let's move to questions. There are a lot, so I'll try and see whether I can find commonalities. First one is from Anita. My question is specifically to do with stair climbing as an exercise. I was climbing stairs twice a week, and now I'm doing 80 floors up only and not down. So right now, Anita is probably on the 7,000th floor of some building because she never came down. But she had a slight twinge in her knee and stopped. And would she be hurting herself or helping if she can continue stair climbing? Maybe lower the number of floors.
So, Nikhil, it's all about activity modification. Now, if she was climbing stairs as an exercise and her knees have started hurting, it's obviously not the right thing to continue doing. But if she has to climb the staircase if her house or her workplace does not have the option of an elevator and she has to climb the staircase, a simple thing you can incorporate is avoid tandem climbing. Means don't climb one step with the right foot, the other one immediately with the left foot. So don't climb one step alternatively, but climb one step at a time. So on that one particular step, put your right foot first, and then instead of putting your left foot on the step which is higher, on the same step, keep your left foot. So go one step at a time and take the support of the railing. That's often some simple trick that I tell patients, and they often benefit with that when they don't have the option of not being able to use the staircase.
Yeah, No, that's perfect. Nadia, the scale you're talking about, I'm assuming you talk about the BCA scale. There are many on Amazon. There is a Renfo Health. Um, uh, there are a couple of others. What we'll do is on the community, we'll post a list of the scales that one can use. Yashoda, your question was, I recently did a DEXA scan as part of my post-cancer annual checkup. The T-score parameter mentioned average Caucasian woman. Is there any study done on average Asian or South Asian women?
Yeah, so she's right in a way that most of these actually reference patients who are in the West, but there are studies which have been done even on Asian patients, and the values are more or less the same. So that's why the guidelines still remain that you should have a T-score which is above -1.
Correct. Then Milind, there's a question. Oral BCAA liquid with HMB supplement is good for hip surgery recovery and rehabilitation. Like, is that true?
No, not really. No.
Okay.
Yeah.
Yeah. I mean, this is actually the type of insight, because I'm sure there's someone out there who said it, maybe
Correct.
trying to sell something. But
No, these are
Milind,
more of
thanks for
fat,
asking.
more of fat supplements, but you don't really need them as long as you have adequate calcium and vitamin D in your body. That's enough for your recovery.
Yeah. And then along the same lines, Monica has a question. Can iron supplements inhibit the absorption of calcium or vitamin D supplements?
So more than iron supplements, what inhibits iron, calcium, and D3, especially in our patients, is the consumption of tea and coffee. So a lot of times you're consuming tea and coffee just before or after your meal, or a lot of patients like consuming caffeine after their lunch or dinner. That inhibits iron as well as calcium and D and vitamin D. So that's what you should avoid rather than, and like I mentioned, rather than taking it on an empty stomach. Otherwise, your other supplements are okay.
Yeah. And I think Makaran's question is around the same. Is it a must that every time you take a calcium tablet, a little dose of D3 is a must? Or if you have good levels of D3 in your blood, then there is no need to add the D3 tablet?
So most supplements do have an adequate and optimal mix of calcium and vitamin D. I mean, it's like a phone and a charger. So you need to have a phone and a charger both for your phone to work well. So most of these times, these supplements have an adequate amount of calcium and vitamin D.
Great. Swati, thank you for your compliment. Sahil, you got a wonderful compliment. Swati said she's really glad she joined. And like I said, we'll put out a video of this thing for anyone who wants to review it later. And Milind asked for the same thing. Nadia's question, if you already have a start of arthritis in the knee, are there certain yoga or other exercises you should avoid?
So what, again, it depends on the level of arthritis you have and the amount of pain. But by and far, avoid excessive knee bending, like sitting in Vajrasan. That does make you feel good for the time being, but in the long run, it's slightly detrimental. So what I recommend to patients is avoid excessive knee bending and any twisting movements on the knee. And if patients are in a lot of pain and they still want to continue with yoga, I advise them to do some chair yoga exercises. So that's a good stopgap arrangements till the pain comes in control, and then you can resume your normal yoga activities.
Yeah. And there was a question that had been sent in advance on the community about someone had an issue with dance, right? She enjoys her dance, but at the same time, it causes issues. And I'm assuming the advice remains the same, right? Avoid.
Yeah, I mean, since most patients really like to be active, I hate telling a patient, now stop going for a run, stop doing your dance activities. The key is to listen to your body. So if you're doing a certain form of dance, which is again involving a lot of knee bending or twisting, pivoting movements, that's not ideal. So you should take a break from that probably, wear a kneecap while you're dancing, and for some time maybe resort to some milder form of dance like salsa or some low impact Zumba. That's also a good thing to do till your knee pain comes in control.
Yeah, I think this particular person is a Bharatnatyam dancer, but it'll be fun for her family to see her suddenly move to salsa. That'll mix it up. And there's a question about, can you reverse or prevent osteoarthritis from progressing further?
So osteoarthritis is not reversible or it's not curable, but it's definitely treatable, which means we can keep it in control, and you can't 100% guarantee a patient that you'll prevent the progression of arthritis, but you can definitely delay the rate of progression of arthritis. So that's the slight distinction between treatment and cure.
Yeah. There was a question from Gitanjali about recommended dosage. Sahil, do you have a recommended dosage for calcium and vitamin D that you would give everybody, or does it depend?
Of course, it does depend in certain patients who have some medical conditions, but by and far, the ideal dose of calcium is 1000 to 1200 milligrams a day. And for vitamin D is again in the range of 1000 to 2000 international units per day. So a lot of times patients think they're taking 500 or 1000 milligrams of calcium and that's enough. But it's important to know that the calcium you're taking in a tablet is not equal to the amount of calcium your body is absorbing. And that is the term which we call as elemental calcium. So if you take a 500 mg tablet of calcium, your body is only able to absorb 20 to 40% of that calcium. So that's why we give 500 to 1000 is because we're assuming that the remaining 50% will come from your diet.
Yeah, and that's a great point. Sahil, I think your question probably was answered from the questions above. Rashida's question was, is there a relationship between proton pump inhibitors, antacids, and bone health, as antacids are widely described as polypharmacy?
Yeah, so like I mentioned that why you should be taking calcium and vitamin D after a meal is because your body needs that acid in the stomach to absorb it appropriately. So if you're taking an antacid or a proton pump inhibitor, the level of acid in your stomach is going down drastically, which lowers the absorption of calcium and vitamin D. So that's why it's not a good combination to be having. And that's why proton pump inhibitors or antacids actually inhibit optimal absorption of calcium and vitamin D.
Yeah. There was a question from, there's a comment from Makaran, which I actually also have a view on, but I want you to answer this first. There's a view that do climb stairs, but avoid climbing down as it puts more pressure on your knees. Your views for those above 65 years and frankly for any age?
So there are two categories in this. If you're younger, it really depends on what ligament injury you have. For example, if you have an ACL tear or a PCL tear, that affects ACL is usually associated with pain while going down the staircase, whereas a PCL injury is associated with pain while climbing the staircase. When you're above the age of 60, 65, it's actually difficult to distinguish because depending on the stage of arthritis and the amount of synovitis you have in your body, what your quadriceps strength is, some patients have a difficulty in climbing up the staircase, whereas some patients have difficulty in coming down the staircase. So there's no really one size fits all answer for this. It's actually individualistic. And again, like I said, listen to your knee joint and wherever possible, avoid climbing or coming down the staircase. If it's giving you a lot of pain, use the elevator instead.
Yeah, and walk on flat ground, right? That's
correct. Yeah, of course.
Perfectly fine. Got it. One interesting thing I remember hearing recently, and Sahil, I'd love to hear your take on it. They said that women, especially in their 50s, are trying to improve their bone health, just doing like 50 jumping jacks, 50 to 100 jumping jacks. That pressure, that impact actually helps with sending that signal you were talking about back to the bone that, hey, I need to do a better job strengthening. Is that true, or is that just a myth?
No, that is true, that with every contraction of muscle, now it's not just jumping jacks, it's whether it's any form of strength training or resistance exercise, it's in medical terms what we call as Wolff's law. So what Wolff's law says is that for every stress that's placed on the bone adapts to increase the density in that region. So that's why muscle strengthening and muscle contraction actually helps to increase the bone density. Now, when you come to jumping jacks, overdoing it is not good because of the ground reaction force that you're essentially generating, which might harm your knees. And that's why a lot of people prefer running on the treadmill and avoid running outdoors, which in the long run can be a bit detrimental. So for people who like running, it's better to be running on grass or a proper track rather than to be running on the treadmill on an incline, because of the ground reaction force that also happens with a lot of jumping jacks.
Yeah. For strength training, there's a question from Suchita. For strength training, is it important to lift heavy weights to increase muscle mass, and how heavy?
Not very heavy, but it's important. I mean, of course, if you can lift 10 kgs, for example, I'm not going to ask you to go to the gym and start lifting 30, 40 from tomorrow. But what you can do is lift or do repetitive sets till failure. So if you're comfortable with 10 kgs and you're comfortable doing 10 counts, try and push yourself to 15 to 20 where you can no longer really do another set. So train till failure is an important message for such people.
Yeah, and I want to just sort of validate that comment. the chances of injury are always higher when you go down the path of increasing the weight.
Correct.
But if you go, say, take the same weight and, like Sahil said, do more repetitions till you can not lift it up again, the chances of injury go down significantly, but the impact it has, the positive impact it has to your body is very high. So, unless you have someone overseeing every aspect of you, go for more reps for the same weight rather than increasing weights too much.
Because when you try and lift a heavier weight than you can actually, or that you're able to do, you start compromising on your form or posture that's important to keep while lifting that weight. And that's when the injuries actually happen.
Yeah. Nachiket, is it too late to start strength training after the age of 50? I can tell you for a fact, no. It's never too late. I mean, I have now seen people that I have, my aunts and uncles who are 70s and 80s. I've gotten them to start. And again, Sahil, your view, but it's never too late to start strength training. Is that right?
Absolutely concur with what you say.
Yeah. We'll stick to the last couple. Please share your opinion on taking Osteoporosis. I don't know what that is, but you probably know.
The Osteoporosis is a bisphosphonate, which the content of the drug is alendronate. Now it depends what you're taking Osteoporosis for, whether it's for osteoporosis specifically or whether it's for other conditions like osteonecrosis or AVN of the hip joint. But by and far, the dose is 35 mg twice a week or 70 mg once a week. And avoid taking these bisphosphonates or the Osteoporosis medicine for more than 2 to 3 years, because that's when there are certain side effects that are quite drastic, like destruction of the bones of your jawbone, as well as it actually has a paradoxical effect where you become more susceptible or prone to a hip fracture. So when you're taking a medicine to prevent fracture, when you take the same medicine for a duration of more than 2 to 3 years, it's actually having a paradoxical effect and putting you at risk of the same fracture.
Great. There are so many more questions, but I think we have to stop here. Sahil has already given us 1 hour of his pretty valuable time. He could be doing surgeries in the same time. But Sahil, I think what we have really left us all with is some very practical ways of how we can all do things right now, either for ourselves, for our family members. But they are all super practical, and maybe I can convince you at some point to come back and give us more such amazing insights.
Sure, definitely. And even the questions that are unanswered, I'm happy if you can just send an email. I'm happy to answer those and get back to you as well.
So what we'll do is we will take we have a list of all these questions. Our team will take them and we'll put them on the community so that we can then get them answers. Instead of everybody writing to you, we'll send you a list. You can answer whatever you can answer and we'll post them back on the community.
Definitely. Okay. Sounds good.
Great. And again, for those of you who enjoyed this session, please join the next one and bring your friends and family. I mean, it's free, right? But you get access to such amazing speakers and they share so openly. So thank you all for joining. And Sahil, thank you again. It was truly an amazing conversation.
Thank you so much, Nikhil. And at the same time, I'd like to give you a shout out for what you're doing with preventive health, because throughout medical school, as doctors, we're only hammered and taught to treat diseases. We're not really taught to prevent them. And that's why I really appreciate and love what you're doing in terms of preventing all these problems. So hats off to you for that.
Thank you. Thank you very much, Sahil. All right. Thank you all. Bye.
Good night.